Hey, what's going on there, guy?
Hey, Dr. Park, how are you?
Yeah, what's going on? What brings you over to see us today?
It's been a couple of weeks now, but I've been having some headaches.
Wait a minute. Neither of us are here until I have the computer turned on. Give me a second. All right, we're good.
Headaches. It's been a couple of weeks. Not real pounding, but I wake up in the morning, they start to come on, and they're just there all day. I got them on both sides of my head, and kind of in the back sometimes. But again, they're not real sharp like a migraine would be. But
and do they seem to come all at one time of the month? Or
no.
How long back? How far back is this?
About 3 weeks.
Okay. Anything different in the house? Anything new, like a carpet or
no, nothing in the house.
Anything that you might be a little sensitized to or allergic to?
I don't have allergies, so that's why I thought maybe that's what it was, but it's not letting up.
And where is it located?
When they start coming on the sides, and then I get it in the back. And I can feel it back here, and then at some points towards the end of the day, it just feels like it's just all around.
Okay, and probably tried Tylenol.
Yeah, Tylenol, ibuprofen.
Doesn't really.
It'll dull them for a little bit,
yeah.
But it certainly doesn't remove it.
Yeah. All right, let me take a listen to your heart and lungs. I noticed that your blood pressure is not elevated. That would also be part of something that we would want to evaluate in somebody who has headaches. Okay, deep breath. Deep breath. Okay, that's good. Well, headaches can really be difficult to deal with. I really think that we could get some help for you, sort of in a different direction. Instead of jumping right on medication, there's a specialist that works with us here in the office, and if you have a few minutes, I'd like for him to sit down and talk with you, and we could tease this thing apart, understand it a little bit better, and develop a game plan. Might be medicine, may not be medicine, maybe relaxation techniques. I'm not sure as of yet, but if you've got a few minutes, let me go get Dr. Corso, and I'll run on and see the next patient. Then I'll come back in after I talk to Dr. Corso, and we'll figure out what we're going to do.
Okay.
All right.
Thanks.
I'll be right back.
All right.
How you doing? My name is Dr. Corso.
Hey, how are you, Doctor?
Good to meet you. Dr. Parker said that you might be having headaches, and he said that if you've got time, I'm happy to see you. We can do it right now and see if we can get a game plan together. How does that sound?
Sure.
Okay.
Sure, yeah.
All right.
So headaches.
Before we begin, let me tell you a little bit about who I am and what I do. Everything I'm going to say is contained in this brochure right here. Okay? I'm a behavioral health consultant for the clinic, and I'm also a clinical psychologist by training. So what that means is I work with your primary care doctor in situations where taking care of your health involves more than just physical factors. So anytime habits, emotions, thoughts, behaviors impact your health, I get called in to help target that one part of your care. Today it'll be headaches.
Okay.
Right? Okay. And in order to target that, I'm going to spend about 15 minutes and ask you several questions about what's going on. And then together you and I will come up with a plan that seems doable for you. We'll write that plan down on this piece of paper and you'll get a copy. Okay? And then I'll also put that plan in the computer so that Dr. Parker can follow up at a follow-up appointment or anytime he needs you just to see how you're doing.
Sure.
Okay? It's also possible that as a part of our plan, I'll give you some reading materials, things that you can read on your own. It's possible that we'll set a few goals of ways that you can manage your symptoms. And if it looks like you're developing some momentum, we may have you come back for 1 or 2 brief follow-ups. Okay, and if you and I think you'd be better helped by a specialist, I can help facilitate a referral to someone else.
Okay.
Okay, but either way, whatever we talk about will go into your medical record, and I'll share that with Dr. Parker.
Okay.
Okay, just like any other medical appointment, there are a few limits to confidentiality, and that means there are situations in which I might need to recruit the help of another professional, okay? And that's if it appears that you're at imminent, and I stress the word imminent risk of harming yourself, harming someone else, abusing a child, something like that. I would need to get the appropriate resources or people involved to help us keep everyone safe.
Thank you.
Okay. Any questions about who I am or what I do?
Not yet.
Okay, okay. So you're having headaches. When did these start?
About 3 weeks ago.
Okay. And are they on one side of the head or both sides of the head?
Both sides. In the back, it's almost like there's like a round band on my head. Sometimes just tightening.
Feels like someone's just squeezing.
Yeah.
Okay.
Yeah.
And it started 3 weeks ago. What was going on in life 3 weeks ago? Did anything change at work, at home?
My workload's pretty intense. My boss puts a lot of responsibility on me. We have a huge project right now for a client.
Okay.
I don't know if that's directly related, but it's around the same timeline.
Okay, okay. And on a scale of 1 to 10, 10 being the most excruciating pain you've ever felt, and 1 being a little bit of pain, what's your pain today?
Today it's probably about a 6. You know, they never get piercing. They're more of just a solid headache all day. Yeah,
kind of headache. Does it throb?
No throbbing.
Okay. Okay. Or does it? It's not sharp, is it?
No.
Okay. Do you feel like light makes it worse, or activity or noise makes it worse, or no?
You know, it's been going on for so long now. I just kind of work through it.
Okay.
But yeah, you know, if it's a little dull in the room, it's a little easier. You know, if I have time, sometimes I'll just try and lay down and just close my eyes, but it's still. You know,
What makes it better?
Finally, when I fall asleep, I don't feel it. So I've taken some ibuprofen and Excedrin migraine. I've tried all the over-the-counter stuff. It'll dull it.
Those bring it from a 6 to a...
I don't know, maybe a 2 or a 3, but it's still there.
Okay. And when you wake up in the morning, is it still there?
Not as much, and it kind of increases. It kind of increases through the day.
Over the course of the day. Okay.
Yeah.
So it's a 6 today. In the last 2 weeks, what's the worst it's been?
Maybe an 8.
Okay.
It seems, you know, it's pretty consistent.
And what's the best it's been in the last 2 weeks?
It really hasn't gone away, so maybe a 2.
Okay. And so on average, in the last 2 weeks, what's it been? It's a 6 today. The worst it's been is an 8. The best it's been is a 2 in the last 2 weeks. What's it been on average?
5 or 6.
Okay. Okay. So today's an average day?
Yeah.
Okay. Okay.
Like I said, it's been going on for a couple weeks now, so I just... You
Yeah.
know, but I thought maybe it was allergies or something, but now it seemed like I wake up and it's there and I go to bed, and I wake up and it's there and it's very consistent.
But I also hear you saying it's less intense in the morning when you wake up, and then it gets worse over the course of the day. What do you do for a living?
I'm a computer programmer.
Computer programmer. So you spend a lot of time with the computer?
Yeah.
Kind of doing this?
Yeah.
Okay.
A lot of screen time.
A lot of what?
Screen time.
Screen time. Okay. Do you take breaks? Smoke breaks? Anything like
that? Yeah, a couple.
Oh, do you smoke?
A little bit.
Okay. Do you use how many cigarettes or cigars do you
I
have
smoke cigarettes, maybe a pack a week.
Okay. Okay.
2, 3 a day tops.
Any smokeless tobacco that you use? No. Do you drink any caffeine?
Yeah. Drink a lot of coffee.
About how much?
I don't know, 6 or 8 cups a day.
6 or 8 cups. Cups like just a regular styrofoam?
No, cups like a hot thermos cup, so maybe 12, 14 ounces, something like that.
6 to 12 of those. Wow,
Yeah.
that's a lot. Have you always drank that much coffee?
Yeah, I always.
Okay.
Yeah, it's like water. You drink water, I drink coffee.
You ever have any problems sleeping?
No, ironically, that doesn't.
You must have a
affect me.
high tolerance for caffeine. Okay. Okay. Do you use alcohol?
Occasionally. Nothing consistent.
Okay. How about, you mentioned ibuprofen, you mentioned Excedrin, you mentioned Tylenol. Do you take any other over-the-counter medications?
No.
Okay. Do you use any drugs, illegal drugs?
No.
Okay. Let me just take a moment and summarize a little bit, make sure I'm following you. 3 weeks ago, you started getting headaches. The only thing you noticed that's different is that work has been very busy. You're a computer programmer, spend a lot of time behind the screen, except for a few smoke breaks here and there. The headaches come on in the morning, and it's usually in the back, and or it starts sort of all around, and then you feel it by the end of the day. It's more intense, and you feel it in the back quite a bit. But it's not throbbing, it's not sharp, it's sort of dull. Okay. Does anything else make it worse? You said it's better when you're sleeping. Does anything else make it worse?
No, not really.
Okay, okay. Except the end of the day. How's your interest been? Do you notice you're less interested in doing the things you typically enjoy, or that when you do them, you get less pleasure out of them?
It's been a little difficult to just do them, period.
Because of that?
Yeah, like I said, if I find time, I'll sit down and lay down and just close my eyes just to try and get control of it,
Okay.
So I've been doing less.
Okay. Okay. And how's your concentration? Increased, decreased, or normal for you?
Normal.
Okay. How about your appetite? Increased, decreased, or normal for you?
Normal.
Okay. And do you notice you're moving kind of more slowly, or the opposite of that, where you're really kind of agitated physically?
No, I don't.
Or just normal?
Yeah, no, I haven't seen too much change in that.
And how's your energy? Increased, decreased, or normal for you?
I guess it'd be technically decreased because I'm just doing less. I'm usually moving a little quicker, and I got a lot going on.
Okay. Okay.
It's starting to affect my way of life.
Okay.
That's why I came to see Dr. Parker.
Okay. Are you married?
Mm-hmm.
Okay. Does it affect your relationship at all with your spouse?
Not right now.
Okay. Okay. All right. Has it ever gotten so bad that you thought about killing yourself or ending your life?
No.
Okay. Have you ever thought about killing someone else?
No.
Okay. Those are routine questions. We ask them to everybody. Okay. I think I have a good sense of what's going on. I'm just going to summarize one more time, make sure I've got it all. Well, I do have actually another question or two. It doesn't impact your relationship. Does it impact you at work? Do you notice you're less productive, or you have to take more breaks because it's bothering you?
Yeah, I find myself slowing down a little bit. Yeah, as I said, it gets stronger as the day gets on. So close to the end of the workday, it's staring at the computer and the headache.
So you're probably more productive in the morning versus in the afternoon.
Yeah, I try to get the more difficult stuff out of the way early.
Okay. Okay.
Because it's been so consistent, I can almost set a clock by it.
Really?
Yeah.
Okay. Okay. And does it follow any other pattern? Setting a clock, does it happen at the same time every day when something else is happening? Like, I don't know, a meeting or anything else that's predictable that you can see as a trigger?
No, again, I don't know if it's just because we're so busy. My boss is a real jerk, so he's on me.
Okay.
And I'm a producer. I'm one of the top producers in the office, so it's important that I keep that up.
You've got pride in your performance, and you want to make sure you're not slipping.
Yeah,
that makes perfect sense. So the headache started 3 weeks ago. They sound like what we'd call tension headaches versus migraines or cluster headaches. Now, I can't officially diagnose that. Your primary care provider has to do that. But in passing in the hallway, Dr. Parker did share that he thought they were tension headaches, and that's what it sounds like to me as well. It doesn't ever get so bad that you become suicidal or anything like that, or you begin drinking more, but you do drink quite a bit of coffee and you do smoke a little bit. Have you ever considered quitting cigarette smoking?
Yeah, I did. I don't consider myself a heavy smoker. I'm only about a pack a week.
Okay.
But
is that something you'd like to talk more about today? Quitting smoking?
If it's something that would directly help me with the headaches, I would look into it. Sure, okay. I don't need to smoke.
Okay. Let's sort of bookmark that and come back to it in a moment then. It doesn't really impact your relationship with your wife, but you do feel like you move slower, lower energy, and you're not as productive at work as you'd like to be. Mm-hmm. Anything I'm missing, anything I left out, or anything that we should mention that's related that we didn't capture?
No, I think we're all there.
Okay. So tension headaches, what that means is the muscles becoming tense. And oftentimes there's medications we can take. As you've said, you've tried the over-the-counter pain medications, and they take it from a 6 to a 2, which is helpful. But what we know about a pain that's ongoing like this is that there's usually something lifestyle related, or something in our habits that might either maintain it or make it worse. And so in this case, one of the things I'm wondering is what your posture is like. How's your computer set up? How's the mouse set up? How's everything set up in terms of posture? Because many people who do a lot of computer time, the arms are sort of thrown forward, which keeps these muscles tense for, I don't know, how long do you do programming? Hours on it?
Yeah, sure, yeah.
Okay, so think about having those muscles tensed, maybe shrugging your shoulders, and do you lean forward and look at the screen? I mean, yourself. What's your posture look like?
This isn't the same as the chair that I use, but I have a stool without a back on it, because I have 2 separate stations that I swing between. But my desk is about chest level. I don't have to stretch so far for the keyboard; it's kind of right in front of me, and then my mouse is right there. So maybe I'm maybe a little more hunched.
And where's the screen? Are you having to look forward at the screen?
Yeah, it's about eye level.
Okay.
So I don't have to go too much this way, but I probably am a little more hunched.
Okay, kind of like this.
Yeah.
Okay, so you're getting all these muscles in here that are tense. Okay. You ever lift weights?
Light weights, nothing.
Okay. Do you do exercise regularly?
A little bit.
Okay. Okay. So let's say, have you bench pressed before?
Sure.
Or have you done curls?
Mm-hmm.
So you've heard people say that when, let's say, you're doing a curl, you don't want to be using any of your back or other ancillary muscles. You want to sort of isolate that muscle, right?
Right.
Well, likewise, when you're doing computer work, notice that you're using all these ancillary muscles that are not necessary just to be typing.
Right.
Right? So I say that because it's a habit that we can get into. And what we know from the research is that we want our bones supporting the weight of our body, not our muscles. And if we're hunched and our back is curved outwardly like that, and we're kind of leaning forward, it's the muscles that are supporting the weight of our body, and over time they fatigue, they get sore, they may spasm, or they may just develop sort of a higher baseline of tension. Does that sound like that could be part of what's happening?
Yeah, I mean, I never really thought of it, but yeah, it could be.
So there's something called cue-controlled relaxation. And what that means is we take a cue or a signal or something that we know it's going to happen over the course of the day, like let's say an email popping up or a phone ringing. What's something that happens every day, multiple times a day in your professional
Probably emails.
Emails, okay. So we would use that as a signal or a reminder to do a few quick relaxation activities, okay? The first one is to roll the shoulders back and drop them, okay? Would you mind if we took one moment and just practiced it?
Sure.
So that you're comfortable with what may help. So when we roll the shoulders forward and back, we're letting the bones support the weight of the arms and the shoulders, okay? And when you get your ears over your shoulders, then the spine is supporting the weight of your head rather than all these muscles in the occipital region, okay? Mm-hmm. So you roll your shoulders back, you move your head forward, back, get it to a place where you feel little tension and it feels like your ears are over your shoulder, okay? And then at the same time, you want to have a slight curve in your lower back and the lumbar region. And you want to just take a quick, deep breath. When I say quick, I'm sorry, it's actually a slow, deep breath. Doesn't matter if it's in through the nose or out through the mouth, as long as it's about, some people count for 3 or 4 seconds on the way in, hold it for about 3 seconds, and let it out even more slowly. So maybe to a count of 6, okay? Let's try that. Now, do you feel okay in general?
Yeah.
Okay. So, one of the reasons why that's helpful is, number one, what's supporting the weight of the body? The bones or the muscles?
The bones.
The bones, right. And why am I talking about breathing? What does that have to do with muscle tension? Any idea? Okay. So you mentioned that you're a little bit stressed at work,
mm-hmm.
right? So what stress is in the body, it's sort of like the fight or flight response, okay? When there's a demand from my boss or whoever, my adrenaline starts to increase, heart rate increases, blood pressure increases, muscles become tense, digestion changes. So all of these things, if you have a stressful job, while you're making yourself tense doing this, unintentionally, making yourself tense, right, tensing these muscles, it's also likely that there are other things going on inside your body in order to keep you operating at the pace and at the performance level that you need to operate. Some stress is good, would you agree? Mm-hmm. Okay. Do you find that you enjoy some level of stress in order to perform well?
Yeah, I like pressure.
Okay. And so that kind of pressure is a good thing in a way. But if we, what we know is that if pressure is too much or there's too much stress, our performance starts to decrease. So just enough pressure to keep us motivated, right? When we take in more oxygen, it actually turns that fight or flight response off. It actually turns that stress response off. And that doesn't mean your performance will decrease, but it just means if you take a deep breath, your heart rate will go back down to a more moderate level, your blood pressure will go back down to a more moderate level, and while you're physically relaxing these muscles, the oxygen will also help relax the muscles because it turns off that what's called an autonomic, sympathetic response. It's part of your brain. It's what your brain does. Mm-hmm. Okay, it sort of turns on or turns off depending on the stress. So, if we were to try cue-controlled relaxation, that would mean every time you hear the email go bing or whatever sound you have assigned to it, you'd sort of check yourself. You'd sit up straight at a comfortable posture, take a deep breath, hold it for a few seconds, roll back your shoulders, keep your ears over your roll back your shoulders, keep your ears over your shoulders, and then exhale. Is that something you think you could try?
Sure.
Okay. Do you think that might be beneficial?
It sounds like it.
Okay.
The way you explain it.
Okay. On a scale of 1 to 10, 10 being the most confident you've ever been in your entire life about anything, and 1 being a little bit of confidence, how confident are you that you can do that?
Probably a 7.
Okay. Okay. Why is it as high as a 7? Why isn't it a 2?
Because it's just something that's not that difficult to do, and if it's going to help ease the tension, I would like that.
Okay. Okay. And why isn't it higher than a 7, like say an 8? What would it take to get you to an 8?
Probably just a couple days of doing it. I just,
okay.
I get caught up in my workday, so if I just, forget to do it. Or
okay. Is there something that we could use on that first day to remind you, like maybe an alarm on you have a smartphone? Mm-hmm. Maybe an alarm on your phone or something, or a text message that would come up, or something like that. If you put it into maybe your calendar the first day, mm-hmm. just to sort of ping you and remind you, is that mm-hmm. something that might help get you more to an 8 in terms of confidence? Mm-hmm. Okay. Something else is coffee and tobacco and nicotine. Those are stimulants, and what that means is they're going to also increase muscle tension. Now we've been talking about tension here because there's something called referred pain. Referred pain is when a muscle here, or there's pain here, and because the nervous system's connected throughout your body, sometimes we feel the pain somewhere else. So it's possible that you're getting some referred pain, but more likely it's that you have stimulants throughout your body when you drink coffee and when you are smoking cigarettes. And certainly if the muscles are tense in here and in here, once you have those stimulants on board, like the coffee and the nicotine, it's going to exacerbate it. So would you be willing to cut back on either your smoking or your caffeine or both? Is that something that's doable for you?
Yeah, I would certainly try on the cigarettes.
Okay. What's a good goal? You're at half a pack a day?
No, I only smoke about a pack a week.
Oh, a pack a week.
Yeah,
okay.
So I mean, I'm 2 to 3 tops in a day. Maybe I could try to cut it down to 1.
Okay, let me get my computer back here. Okay, so cut it back to 1
a day.
1 cigarette.
Try.
Okay.
Yeah, I don't think I want to try cold turkey, but if I could do 1 a day, maybe I'll.
Okay. All right. Let me just make sure I've got the planning here. And on a scale of 1 to 10, 10 being the most confident you've ever been, how confident are you could do that?
I'll do a 7 on that one.
Okay. Can you think of anything that would get you to an 8?
Probably maybe just realizing that I don't need it. I'm a little worried about the nicotine. So if one's enough, let's maybe try just one.
Okay. I don't think I understand what you mean.
Well, I'm worried if I was smoking 2 or 3 a day, and now I'm going to go to 1.
Okay, so there's a little. You're concerned that might be a big jump.
Yeah.
What if we said going from 3 to 2 a day? Would you be more confident that you could do that?
Yeah.
Okay, then let's we don't want to overshoot things. Let's just do decrease to 2 cigarettes a day.
Okay.
Okay. All right. And how about coffee? Any chance you could decrease some of the coffee?
Probably. I like coffee. That's one of my biggest problems. I enjoy it. I'm certainly going to drink it in the morning. Maybe I can cut out the afternoon coffee and either get a decaf or...
Have you ever done half calf, where you put half caffeine, half decaf, so that for every cup you're still getting some caffeine, but it's about half the...
No.
In other words, if you usually have 6 to 8 cups a day, you could still have the same volume, but you mix half and half, so that you still get the flavor. It's the, sometimes I get the sense that it's a bit of a habit, a ritual for you, and that's very common. But you're not quite dosing yourself the same way.
I could try that.
Is that doable?
Yeah.
Okay.
I wonder if they make a coffee like that.
They actually do. They do make a half calf coffee that you can buy in the store. And I don't know in your office if they have,
I have my own.
both. Oh, you have your own pot. Okay. And then I also have a handout for you on headaches. Would you be willing to take a look at that?
Sure.
Sometimes what people will do is keep a headache diary or a pain diary, and that can help us track what's working, what's not working, what are sort of the reliable triggers or the things that make the headaches more likely. I don't think we need to do that at this point. I think we've got a solid grasp on where it's coming from. The fact that it's lower in the morning but higher in the evening after you've been doing work all day is a kind of a slam dunk for it having to do with work and just your stress level over the course of the day. Okay. But there's some other information in there. It goes over relaxation skills and things like that. So when you have a moment, read handout on headaches. Okay. And then I've got a quick pain inventory here. It's called the Dallas Pain Questionnaire. And what we know about pain and headaches is that we can talk about what the pain is like on a 1 to 10 scale, and there are times where we might be able to lower that number, but at the end of the day, how we're able to function and what our quality of life is tends to be what we value. In other words, if someone says you're going to be stuck with a headache every day for the rest of your life that's at let's say a 3, how would you feel about that?
I would like that.
Yeah, I wouldn't either. I wouldn't like that either. But what if we said, it's going to be a 3, but we're going to teach you some ways of how to not let it get in the way of your personal life, your professional life, everything else.
Okay.
Does that make you feel a little bit better?
Yeah, I mean, aside from the Excedrin and the Tylenol, if there's something I can do situationally that will fix this, I'm not real big into the medicine.
Okay. So I want to be clear. I don't think that's where we are, that you're going to have this forever. But what I'm trying to explain is that quality of life is important.
Mm-hmm.
Would you say your
Sure.
quality of life is important? Your day-to-day, how you're enjoying life?
Mm-hmm.
Okay. So that's what this taps into. And that's kind of... So when I see you next time, what we're going to talk about is not only what your pain numbers are, but also how's your functioning. Are you able to really continue being the top performer at work? Are you feeling that same energy you used to feel? Okay? So take a moment and just fill that out, please. And I'm just going to write your plan here in the computer. And then this is the plan we talked about. Take a look at this and tell me how this sounds. If you want to add something, take something away.
That's good.
Looks good. Okay. And usually we give patients a few weeks to sort of have a chance to implement the plan. 2 or 3 weeks is usually what we do. Do you feel like you want to come back in 2 weeks, 3 weeks? What feels?
2 weeks.
2 weeks. Okay, that'll give you a good chance to implement it, and then.
Mm-hmm.
Okay. All right. Okay. Any questions for me, or anything else I can do for you today?
No, just make these headaches go away.
I think we're on track. I think we've
All
got
right.
a good plan.
Thank you.
Okay. Thanks.
You got
Great.
it.
Thank you. Sure.